Well, welcome back, everyone. Hope you had the opportunity to get yourself something to drink and take a little bathroom break. Um, I kind of just wanted to start out, get us moving a little bit. I have taken a couple of conferences, and one of the things that really stuck out to me is how we use music, and using music and kind of instills the learning into our brain as well. So I'm just going to play a brief clip so we can kind of get moving a little bit. I need to get moving as well. So you guys, feel free to dance, be silly for just a second. Let's shake it all out because the topic that we're getting ready to discuss, it's very heavy. Very, very heavy. And I just kind of want to get that brief burst of energy out, get us moving, get our blood going, get up and let me share here. Okay, are we ready? Can you all hear it okay? Okay, are we ready? Big breath in. I really just kind of want to start this and preface that with myself needing to do this. I know in January, I'm going to stop sharing my screen real quick. There we go. I know in January when we brought the initial topic to you, we started out with substance use disorder, and we talked about the face of substance use disorder. I ended that presentation with being very vulnerable with you guys and sharing my personal journey, my private story. And I had told you then that this isn't something that happened in the past. It's actually currently happening right now. And I preface that again with this is continuing to happen. I continue to deal with this. There are some things that I can share. There are other things that I am careful about what I share on this topic. And that being said, the reason that I'm careful about that is I am working with federal investigators on my particular case. Um, and so I want to get education and awareness out there. I've been warned in the background by others that I need to be careful who I speak to, what I'm saying, and what I talk to. And I've gotten to this point that I can no longer remain silent about this. I have to get awareness out there because heaven forbid that another family member starts dealing with this, has to deal with this, and ultimately ends up with the death of their loved one or their child, and at least didn't do something to help. So I'm being brave and sharing and being vulnerable. And previously, I read a lot. Brene Brown, Elizabeth will tell you, Brene Brown is one of my favorites, and she is a shame researcher. And she talks about being vulnerable. And I've really kind of taken some of her books and her teachings and things like that to heart and say, this is me being vulnerable with you guys as well. And I'm so thankful and grateful that we've been able to build this partnership. With that being said, we will get started here. And I will go into my, sorry. Gotta love technology. Let me bring this back up so I can share my screen with you again. Sure. Okay. And just want to back up one. So what we're talking about here is body brokering, the patient shuffle. And you may not have heard that term, may not understand what that term is, and I'm going to give a really brief overview. Body brokering and patient shuffle is human trafficking in the addiction treatment centers, detox centers, and rehab sober living homes. And that's a broad overview of that. And why it's called body brokering is because brokers oftentimes are paid anywhere from $1,500 up to $3,500 per body, per head. And what that means is that depending on the individual's insurance that they have, that are seeking substance abuse treatment in a center. Oftentimes we think of that as a detox anywhere from 7 to 10 days. Then they go to an inpatient intensive treatment center for 30 days typically. And then they're transitioned into what we call transitional housing, sober living, recovery homes, in an effort to help them defeat their disease, or at least get to a point of recovery and sobriety. So based on your insurance that you present to the detox and the inpatient treatment, the body brokers who have relationships all across the country with multiple detox and rehab centers are paid based on your insurance. And be prepared, be ready. This is a Hollywood film that's coming out. It actually is being released tomorrow. And this is the beginning of awareness and education. And yes, it's a Hollywood film, but it is actually based off of actual events. This is currently what is happening personally to me and to my son. And in my bio, you'll notice that I'm also part of a documentary. There will be a documentary that highlights my story and my son's story. It is slated to come out in late spring, early summer. I don't have an exact date for you yet, but I do work with that producer and trying to keep things going with that. Our initial thoughts on this was Hollywood beat us to the punch. You know, people are going to glamorize this. And while I think that there's some fear around that, I also think that this is going to propel awareness and education forward. And it will definitely help prepare and propel that documentary, which is actual true life stories and events that are occurring currently. And I have it pulled up. Let me stop sharing for just a second. And are you able to see the screen?
Yes.
Perfect. Buckle up. Thoughts? How are we feeling about that?
It's an evil world out there.
I just have some thoughts of disbelief. Like, I've been really blind to that, I guess. And it's really amazing that that happens.
Mm-hmm.
Being in the mental health world, you know, I'm always there to want to help my patients, and I just can't even imagine that there are people out there trying to take advantage of patients in need. It's shocking.
I had no idea. No idea.
And Deanna, I don't know if you want to share how to, and maybe you're going to later on. This is not the fly-by-night places. These are the places that have all the credentials that you look for. I mean, not all of them, but several of them do. When you look at their website and see where they're accredited from this organization, that organization, they're doing this too. So that's why it's so difficult for these people to find effective treatment.
And I think it's so eye-opening because you think, well, that's a good thing. I mean, substance abuse counseling has to be covered. And here I'm thinking, and treatment, I'm like, boy, that's a win. And then the unintended consequences, I think sometimes we don't even think about with laws and legislation that, you know, you can look at it as, oh, that's a good thing. It has to be covered. You don't think about it as the other thing that people are going to take advantage of this.
It's exactly right. And the rest of the time that we have together, I'm going to go into detail on how it's being taken advantage of. How is this operation working? What does that look like? And I just wanted to bring awareness to this. Wanted to let you know that this was occurring. I have a lot of people that reach out to me and say, well, then what is a good treatment center? I'm not saying that there aren't good ones. I really am not. But there are things, family members, I want you to know what to look for. I want you to know the questions to ask. From healthcare providers, be thinking about that. Ask those questions as well. I can tell you, 15 years of struggling with my son's active addiction, that a year and a half ago when he came to me and said, oh, I want to go to treatment, my first thought, and I'm a nurse, I'm educated, like I thought I knew everything there was to know. And my first thought was, yes, finally, he's wanting help. He's going to go get help. He's going to get checked in. We're going to do this whole family counseling. We're going to heal as a family. And he's going to come out on the other side and he's going to use his story and help other people. And so even I was blind to what was actually going on. And the proof was all right in front of me the whole entire time. But because I was in such turmoil and such chaos, I didn't put the pieces together until I put the pieces together. And when I put the pieces together, I was sick to my stomach. I was in disbelief. There was even a piece of me that said, you're crazy. Like you're paranoid. There's no way, like, how can this be occurring and it be somewhat legal? How does this happen? And there's one thing I did want to share with you guys. So the clip of the movie kind of gave you a little overview and a little brief intro into what's really occurring in detox, rehab, and addiction treatment centers. And what I can share with you is, do you see this stack of envelopes? This is 6 months of explanation of benefits. 6 months. That's it. This isn't years worth. This isn't, this is 6 months of explanation of benefits, 6 months of where my son and the treatment center that he was in has billed my insurance company. What they're billing is approximately $3,700 a day. So when I did the math on this, and that's just for treatment, that isn't the urine drug screens, that isn't medications, that isn't anything. This is just the stay. When I did the math, it's $81,000 a month that insurance is being billed. Why is this everyone's problem? Because everyone has insurance policies. Everybody pays premiums. Those premiums go up every single year because of this. 6 months. That doesn't include the stack that I've already had. So this is everyone's problem. There does need to be oversight. And let me share my screen again. Sorry, I'm a little, okay. Okay, are you able to see my screen okay?
Nope, we'll need to switch we're seeing your second screen again, I think.
Are you seeing discussion points?
No, we're seeing your whole screen with your slides on the side and
All right, Allie, this is where you come in.
I'm trying to remember what we did yesterday where we had to switch swap the two, where you go up to the top and do swap.
Sorry, guys.
Allie, does she need to put it in like the slide view? Is she just in the wrong view?
She's in slide view. She uses two screens, and it switches on her occasionally. Which screen is her primary screen? We haven't quite figured out why it likes to switch on her. Sometimes it will switch. You can kind of see those gray boxes there. Which screen is her primary screen?
All right, let's try it again.
So yeah, if you go back to share screen, which I know you've stopped share, and share directly from your PowerPoint like we did last time instead of doing your desktop, let's try it that way. There you go.
Perfect. Perfect. Okay. Okay, so we talked a little bit about the discussion point on this, about how did it make you feel, and what your thoughts were. How are you going to be able to identify individuals who are caught up in the shuffle? So how did this get started? It really talked about in the beginning, it talked about Affordable Care Act in 2008. Along with the Affordable Care Act in 2008, we also see the Mental Health Parity and Addiction Equity Act. It's a federal law governed by CMS to prevent group health insurance plans and companies from disallowing coverage of mental health or substance use disorder. Meaning what was meant to be a good thing, just like you said, Elizabeth, it can't deny substance use disorder treatment or mental health treatment, that these become deemed essential benefits. It also allowed parents to keep their children on their policy until the last day of the month of their 26th birthday. So this is kind of where my son fits in. He was able to stay on my policy until the end of August when he turned 26. It also prohibited declining coverage due to pre-existing conditions or dropping your insurance coverage if you were ill or being treated for a disorder or a disease. So there's actually 6 classifications of coverage according to the MHPAE, Mental Health Parity and Addiction Equity Act. The 6 classifications of coverage are inpatient in network, inpatient out of network, outpatient in network, outpatient out of network, emergency care, and prescription drug coverage. The interesting thing is there's a note that's attached to this, that if a plan or coverage generally excludes all benefits for a particular mental health or substance use disorder, but it includes coverage for prescriptions that are related to a mental health disorder or substance use disorder. Therefore, the plan then has to cover all 6 of these classifications and conditions, or it falls outside of the Mental Health Parity Addiction Equity Act. So basically what that means is, no, we're not going to cover detox centers. We're not going to cover addiction treatment inpatient or even outpatient, but we'll cover a classification of prescription drugs that is specifically meant for mental health disorders. Those classifications of drugs, a lot of times what you'll see prescribed, this is going to be a key indicator for you guys as well in the emergency room, lithium. You'll see lithium, you'll see heavy dose antipsychotics, Seroquel, the Zyprexas. You may see an anti-anxiety drug being thrown in there as well, Ativan, those kinds of things. Now, pay attention to the fact that in my son's case particularly, he already suffers with substance use disorder. His drug of choice is heroin. And then he's turning around and being prescribed from a detox center or an inpatient treatment center. He's being prescribed antipsychotics, Seroquel, all drugs that have key indicators for high abuse potential as well. Lithium level toxicity, blood levels aren't being checked monthly. They're just prescribing him lithium. They have diagnosed him with a co-occurring mental health disorder, which again, I don't disagree with. What I disagree with is he's being diagnosed by people who are not professionals. And they're just kind of throwing out some terms, oftentimes you'll hear bipolar. I've heard that it's bipolar disorder. That seems to be the key one that they want to treat. So addiction treatment centers and detox centers, kind of as Christina alluded to with human trafficking, how it's a multi-billion-dollar a year industry. Addiction treatment centers, for-profit treatment centers, which include detox, inpatient units, outpatient facilities, sober living homes, is a multi-billion-dollar a year industry. Remember, I said $81,000 a month is what they're billing insurance. That's one person, 81,000 a month. Oftentimes there's little to no oversight from state or federal agencies. Most of our government agencies, we regulate everything, right? We regulate hospitals, we regulate colleges and universities, we regulate daycare centers. there's little to no regulation. There's no oversight, no huge governing body that regulates detox and inpatient treatment centers. There is not a special requirement that you must have this education to be able to open that. I can open a detox center. I can open a sober living home. I can open an addiction treatment center, and I can charge insurance and get the money for that. The regulating bodies that do exist for these treatment centers are the Joint Commission. What I want you to understand about the Joint Commission, it is not a required governing body. It's actually an exclusive club/service that is paid into by a facility to prepare them or their organization for a state inspection. So you pay to be a part of Joint Commission. You also have CARF, or the Commission on Accreditation of Rehabilitation Facilities. Again, you pay to get that certification as well. The steps to accreditation for CARF include: you consult with a designated CARF specialist, you conduct a self-evaluation, submit the survey application with detailed information about leadership, the program and services, and the service provider that you're seeking to accredit. CARF invoices for the survey fee. It's not free. They invoice for that fee. CARF selects the survey team. The survey team conducts the survey. And then CARF renders the accreditation decision. You can either have a 3-year, a 1-year, a provisional, or a non-accreditation. Typically, it's a 5-year term of accreditation, and it takes 6 to 8 weeks after the survey for CARF to notify the service provider on their decision. Then the facility will submit a quality improvement plan within 90 days. They'll submit an annual quality report that keeps their accreditation going. And then a CARF does maintain contact with the service provider, and our service providers are encouraged to contact CARF if they have any questions or help. Again, it's a service that's been paid into to get that accreditation. Golden ticket. So who are the golden tickets? In this particular scenario, insurance companies that are considered golden tickets are Anthem, Blue Cross Blue Shield. Somebody might have to help me with this one because I don't know how to pronounce it, but Centene.
It's Centene, which in
Centene.
Indiana would be Managed Health Services is what they go by in Indiana.
Got ya. United Healthcare, Humana, and then oftentimes these private small insurance companies. How that happens and what happens is, in my son's case, he's 26. He's now maxed out of my insurance. These treatment centers purchase insurance policies for them. Unaware, my son being unaware that an insurance policy was ever purchased. Liquid gold. What is liquid gold? So not only is the treatment center billing my insurance $81,000 a month for treatment, then they bill for urine drug screens. And in healthcare, the urine drug screens that they're using is the same urine drug screen that you and I could go to CVS or Walgreens or wherever and purchase over the counter for about $25 to $45. It's just a dipstick that'll tell you what substances are in that urine. What's happening here is that clients are encouraged to provide a urine specimen in a cup. That cup is then collected, and that cup is then sent to a lab elsewhere, typically out of state, typically in a different state, by a contractor contracted lab company that is also owned and operated by the same people who own and operate the addiction treatment centers. And then they start running urine screens for TSH, T3, I mean, you name it, every vitamin level, genetics type testing. Even though my son's drug of choice is heroin, they'll run his urine for barbiturates, they'll run it for, amphetamines, all while he's in treatment. He is in a locked facility, not leaving, not having visitors. Every single day, he provides a urine drug screen that gets sent again to a lab that is often owned by the addiction treatment center owner. Urine is considered liquid gold. Urine testing is big business. We're all paying for it because Medicare is paying for it. In fact, the program is writing multi-million-dollar checks to companies that perform these lab tests. There are virtually no national standards regarding who gets tested for which drugs and how often. After reviewing billing data from Medicare and private insurance companies nationwide, Kaiser Health Network found that spending on urine screens and related tests quadrupled from 2011 to 2014 to the tune of about $8.5 billion a year. That's just for urine. I want to show another short clip that'll explain this a little better. I think I have to stop sharing that screen.
Want to know how a simple urine test turns into a nearly $2,000 bill? Well, here's a real-life example pulled from federal court records. The lawsuit involved a major insurer, Allstate, claiming that it was overbilled by Ameritox, a major lab. A patient identified only as JM urinated into a specimen cup on March 5, 2013 at Valley Pain Specialists in Bethlehem, Pennsylvania. 1 day later, the cup was logged into an Ameritox lab about 1,800 miles away in Midland, Texas. Lab technicians tested the urine for 16 different drugs and issued a report the next day. The report showed JM's urine was positive for oxycodone, a narcotic painkiller, and carisoprodol, a muscle relaxant. Both of these were drugs JM had been prescribed. The lab also ran tests for cocaine, PCP, methamphetamine, and methadone, but no traces were found. Ameritox billed Allstate $416.13 for the initial round, but Ameritox didn't quit there. It ran more sophisticated tests to confirm the initial findings and charged Allstate separately for each test. Here's that list of tests. Benzodiazepines, 7028, amphetamine or methamphetamine, 11808, barbiturates, 4351, cocaine, 5757, marijuana and 2 other drugs, 323, meprobamate for anxiety, 93, methadone, 12411, opiates, 44345, PCP, 5583, an unspecified lab procedure, 4384, creatinine, 22, and the total bill for JM's tests, $1,845. In court filings, Allstate said the lab engaged in a fraudulent scheme to bill for excessive and unnecessary tests. The suit has since been settled, and Ameritox declined to comment, but experts say over-testing is a persistent and costly problem.
So that just gives a little bit of information as far as how the urine drug screens are processed, what's really going on with urine drug screens. Oh, sorry. And how it is a multi-billion-dollar a year industry. share my screen again. Perfect. So you can kind of start to see and understand the problem and the process that we have going on here, the unethical practices, the just overbilling, and really what's going on in the industry in general. So how does it really work? It's the 1-800 help me scam the system, what I referred to. What happens is individuals typically call a 1-800 number, 877-866 number, seeking help or seeking treatment. 1-800 addiction is us. And what happens is that phone is answered by an aggregate call center, which is out of state, and typically or has an out of state number. Immediately when that phone is answered, the individual is asked about their insurance policy and what their insurance policy number is to determine what's the best treatment center for them to attend. That's their first connection with a broker. That broker befriends them. He gains their trust. He grooms them. Kind of like Christina talked about. This is the grooming process. I'm your friend, bud. I've got you covered. We're going to get you help. We're going to do that. I've heard it all. I've listened to those phone calls when my sons called these numbers. And then they attempt to connect you with treatment centers that are typically out of state. Not always, though, because this is what I hear. Well, Indiana doesn't have a problem with this. It's Florida, it's California, it's Arizona. Indiana emphatically has a problem with this. My son was brokered from Indiana to Florida. I can probably walk into a treatment center today and ask the clients that are in there for their license, and at least 50 to 65% of them will have out-of-state licenses. People are being brokered across the country. Indiana is accepting people from New Jersey, New York, Pennsylvania, Maryland. They get here, then they get brokered someplace else. So what are the 23 signs of exploitation? I will not read through this whole thing. It's part of this PowerPoint presentation. I can do it as a handout for you as well and get that back to you. These are some of the things that are really huge red flags of exploitation. The ugly side of this is these brokers often reach out through individuals on support groups on social media. They find them at homeless encampment offers, and they offer treatment and insurance. They find them at meetings, AA, NA meetings. They find them at those type of meetings. They have a victim profile. They're looking for individuals that are involved in the criminal justice world. They're either on probation, they have pending charges. They're really looking for that kind of person. You often hear they request them to sign a HIPAA for that treatment center. Tell them not to speak to their families. Again, there's this isolation and separation that's occurring as part of human trafficking that kind of Christina told us about. We need to get them away from their support system. We need to get them away from their families. How do we do that? We get them out of state. They'll talk about things like scholarships. What that means is, hey, you bring a friend or two that has a PPO, we'll get you a free bed. It's a buy one, get one opportunity. What ends up happening is they just double the bill on the other person's policy. For instance, my son, who currently doesn't have insurance to my knowledge, is probably somebody else's insurance is being overbilled to cover for my son's stay. He's on scholarship. Free sober living if you go to the rehab they choose. Well, we can only get you a transitional housing sober living center after your treatment if you go to this one, because those brokers have relationships with those individuals. You hear things going on with other clients and you confront them as a family member. If I confronted something, I would get, oh, they're an addict. They're crazy. Don't listen to them. That's just part of their addiction process. And kind of really, buying into that fear tactic there. You'll see these brokers go live on Facebook to promote awareness. A lot of these support groups that I'm out here fighting for the broken are the brokers themselves, like actually promoting, I'm doing this work, I'm doing God's work, I'm helping people. I was in this same situation. They throw around statistics and percentages that they think help support their argument, why they need treatment now. If it's now, you need to get them here now. You'll see them pay for a plane ticket to get them from point A to point B, which is illegal, by the way. It is illegal for that treatment center to pay for a flight. The first red flag should be the fact that they are a rehab marketer. And they'll kind of market themselves like that. You'll hear that on social media, or they'll tell you that to your face. Like, oh, I'm a marketer. I have relationships with all of these other treatment centers. There's many other different scenarios that I could go on and on about. It's not an all-inclusive list. But these are things that I want parents to be aware of, healthcare providers to be aware of, these questions that we need to start asking. Devil in disguise. So who is the devil in disguise? It's the broker. This system runs and it operates. The broker themselves oftentimes were a person in treatment, was an individual that was suffering with substance use disorder. Unfortunately, what happened is they were groomed. They were given tools. They traded their drug of choice for a new drug of choice, which is money and greed. There's a cult mentality that is brought into this. They keep their victims, the people that are being trafficked, for insurance policies. They use coercion. They use that fraud. They use force. Personally, and again, alluding back to Christina's AMP model, my son was, there was an initiation for him. It is confinement because he is involved in the justice system, and they know that, and they use that to keep him in treatment and to keep him relapsed into another treatment, and the cycle just continues. They separate them from their family, their support systems, and their surroundings. Sober living homes or transitional housing that's not accredited, that doesn't have any license whatsoever. They're charging individuals $200 to $300 to $400 a week to stay in a bedroom that they have to share with somebody else. And if they don't pay that, they often find themselves thrown out of the sober living home with no resources. They find themselves victims of crime. The dealers are oftentimes sitting outside the sober living homes and providing the drugs of choice to individuals who just got out of treatment to get them relapsed, to relapse them, to get them to go back to detox, to go back to an inpatient treatment center and start the cycle all over again. That's where they make their money. They make their money by keeping him sick. So there is a law. It's called the ECRA law. The DOJ did issue a press release on January 10th of 2020 that the first criminal prosecution under Eliminating Kickbacks and Recovery Act, which was signed into law in October of 2018. Now, this is 2020, signed into law in 2018. This tells you how slow this kind of moves and this process and everything that they have to get on these individuals to really be able to prosecute and have a rock solid case. ECRA prohibits knowingly willfully soliciting, receiving, paying, or offering any remuneration, I think that's what that's supposed to say, including kickbacks, bribes, or rebates to induce a referral or an individual using services of a recovery home, clinical treatment facility, or lab if paid by commercial or government-funded healthcare. Again, it's a great start. We need to do more. We definitely need to do more. There are grant funding opportunities available. I won't spend a lot of time on that. I can hook you into some resources. This is through OJP and ICJI, or Indiana Criminal Justice Institute, typically has a lot of additional funding and resources to kind of combat this as well. So final thoughts and discussions here. In the interest of time, I had something I was going to read to you. I'm going to skip that for the most part because I'm sure that there's going to be questions. But just kind of wrapping this up on my final thoughts. What I want to show you is, this is my son 1 year ago. January 20th, 2020, he arrived in Florida for substance use disorder treatment. Again, pay attention to some of the branding and the things that Christina talked about. There are some branding situations and identifying marks on my son as well that you can kind of briefly see in this picture. This is January 2020. He was in Florida from January until the end of November of 2020. And this is January of 2021. Almost a year in treatment. Do you see the difference in my child? In the weight loss, what he looks like, his eyes. This is him actually returning to Florida for substance use disorder treatment after only being home for 2 months. This is the picture that when you're talking about in your mind, who do you picture coming into your emergency department or your clinic that's dealing with substance use disorder that you may not think is a victim of human trafficking? They're just, those terms that we've used, just an addict, a drug seeker. This is the picture that you think of. This is the picture that I think of. This is a grandson and a grandmother who are hugging and saying their goodbyes as my son was getting ready to board a plane to be trafficked back down to Florida again in January of 2021. This is the sheer grief on my mom's face, knowing that this may be the last time that she gets to see my child. This is me and him. Obviously, you can see in this picture that he also is not sober. If you see the pinpoint pupils, he had to not be sober for that, so that when he got to the detox center and they screened him for drugs, that he popped positive so that they could confirm and verify with whatever insurance they were using to be able to bill that out. These are the pictures that I think you typically see as far as an emergency room healthcare worker in a clinic as well. But when I think of my son, this is what I see my son as. These cute little innocent face. I always picture him this way. He is the face of substance use disorder. He is the face of a person who's been trafficked. He is the face of somebody who is caught up in body brokering and the patient shuffle. That is the conclusion of my presentation. I know that was a lot of information. Like I said, I could talk for 2 days just on this aspect of human trafficking. I am available for questions. I am available to come and educate. Whatever it is, the more people I can educate and the more awareness I can bring revolved around body brokering, the patient shuffle, the better off that we're going to be. I do not want another family member, another mother, another father, anyone to have to deal with the death of their child, whether it was from an overdose or a victim of foul play, because they're wrapped up in body brokering and the patient shuffle. Thank you guys so much for everything and for giving me the audience to listen. And I'll figure out
Thank
how to
you.
stop sharing my screen.
Thanks, Deanna. Questions for Deanna? Or comments? Or is everyone just overwhelmed? I know it's been a long morning with a lot of deep, thick information and a lot to process.
This is Stephanie, and I will first start off by thanking Deanna for her courage and perseverance through this time and journey that she continues to be on. I think it's very humbling knowledge to have, and it makes me, I guess the one word that I can say is angry, because, you know, as with all legislation, you really have the intent and purpose that it is designed to help our most vulnerable. And by taking advantage of this group of individuals, regardless if it's addictions or any other domain of individuals, I personally felt that there were laws in place to prevent these anti-kickback and antitrust issues from occurring. And I really appreciate the knowledge, because this was a blind spot to me. Because when you refer patients through the behavioral health consult process, whether they're in the emergency department, they go to an inpatient facility, and then, you know, the cycle does become somewhat of a revolving door, because this is a tough disease. And to have them fall prey to these systems, it's just overwhelming. And so thank you, Deanna, for sharing that. And my heart just goes out to you.
Thank you so much. Thank you for those kind words, and thank you for just listening and opening your eyes. That was my hope. Open your eyes to see, to question those things. Not all treatment centers are equal by any means. They are not. And just bringing awareness to this. Thank you so much.
Jane, would you be willing to share some of your experiences that you've had with healthcare providers and just some insight that you've had with your many years of experience at Williamsport and other areas?
Certainly. You know, my thought, I've done this for 30 some years, and I've done child welfare. I've worked with adult protective services. When I first realized that human trafficking was here, it was like a kick in the gut. Like everyone else, I guess my thought was, it doesn't happen in these small rural areas. I received a call one day from a healthcare provider's office, not Ascension Williamsport, not one of our clinics, but a practitioner had a patient actually come to her and say, I'm not safe. And the person drove a long way to get there. Red flag to me. When you drive an hour, hour and a half to somebody's office and you say, I'm not safe, I guess, please ask those questions. Try to get that confidence, that trust. You're not with someone very long. Don't judge. Ask if you can help. Ask maybe what you can do to help make them safe. Ask questions. Again, don't make it their problem. Try to become part of that solution. Certainly don't let them leave and then contact someone and say, you know, you might need to call this person. I think they're not safe, because at that point, my judgment is Do I put them in more jeopardy if I make that phone call, or do I sit up all night and worry about this person and hopefully they'll come back? You know, healthcare is what everyone says. That's where a lot of them enter. So please, I can't stress enough to ask those questions. You know, I've seen many children in facilities, and now I'm beginning to question, Deanna, some of those children and things that were said to me back years ago, because I assume if it can happen in a drug institution where we think we're sending people for help, it can happen in a place where you place a child. So please take the time to ask those questions, and don't be judgmental. It could be any of us at any given time, or our children, our grandchildren, or a family member. Thank you so much, Deanna. Thank you. I appreciate you, Elizabeth, and I thank you for claiming me.
Thanks, Jane. I just want everybody to realize, you know, this really is everywhere. Any other thoughts, comments, reactions? We'd love to hear from you.
I know we're a little bit past our time. Elizabeth and I look forward to meeting with everyone to help develop your action plans and next steps on how to work on both substance use disorder and improving care for patients, and identifying and assisting the human trafficking victims. And big thanks to our presenters today, Christina and Deanna. Again, lots of great information, lots of good resources to review between now and our in-person meeting where we develop those action plans. If there are questions you have along the way, feel free to reach out to Elizabeth and I, and we'll be more than glad to assist. And we just really look forward to working with everyone on these topics and addressing healthcare in this manner. And our goal is to change behaviors of both communities and of healthcare workers in assisting these individuals and understanding their problems and concerns. So stay safe, stay warm, and we look forward to working with you. Thanks so much. Bye-bye.